My name is Angela Davis. I'm a registered nurse in Kansas City, Missouri at Research Medical Center, an HCA facility. I'm also a member of the National Nurses United. I'm here today to ask you to join our fight to ensure that we have proper PPE for all nurses who have to come in contact with any kind of coronavirus patient. Our union has been fighting since January, like tooth and nail, to try to get the proper PPE that we needed for our RNs. And for our doctors, to be honest. We've had to fight to get N95s, gowns, proper isolation of patients, better care of nurses after they got sick. In January, our PPC sent out a warning letter asking HCA to give us numbers on how much PPE we had and what kind of plans they had in place, and essentially to gird their loins for the incoming pandemic. This was in January. A few days later, they responded to our email with a simple message that stated, "We have an action plan in place." Although I don't know what that is. To this day, we've never seen a plan go into action. In March, we began getting patients for the coronavirus. And when we asked about these certain plans in place, we got a lot of blank stares and a sense of blatant disregard for nursing and their lives. We found out that they were starting to fit test some of the doctors that may be rounded in the emergency room or on certain floors, but they had no plans and no intention of doing fit testing for N95 masks for the nurses who would be caring for these patients day in and day out. So that was another thing we had to throw a fit about. A few days later, they did start fitting us. In April, on the 1st, we participated in a nationwide protest across 15 HCA facilities in the country, protesting that we needed better PPE, we needed more testing, and we needed better isolation of patients who were here for the coronavirus, or even people that we were awaiting test results. We've had crazy code blue situations in our hospital where we didn't have enough PPE and it was locked up. They took it all out of every single storage room in the entire hospital and they locked it up in one central space. So when you have someone going into a code blue, you can't just run in there without all of your proper gear on. And we watched a lot of these situations start going south. We've had numerous RNs get sick, and one recently just died. Please don't doubt that your facility will put financial interests over the protection of registered nurses. Don't wait for a crisis to be at your front step before ensuring that nurses are protected. Join us in the fight to ensure that all nurses and patients have the proper protection. Thank you.